Are you or any of your loved ones planning to fast for your religious beliefs in the coming days? Or are you considering intermittent fasting for fitness, but concerned about managing blood sugar due to type 1 diabetes? Let's go. In today's presentation, we will get all the information that will allow us to fast while managing our diabetes and achieve the satisfaction of fulfilling our religious or fitness commitments. Hello, namaskar, adab. Friends, most people in the world follow some religion, and almost every religion talks about the importance of moderation in our lifestyle, for which fasting or eating abstinence is considered an excellent method. Recently, intermittent fasting has become quite popular for health, fitness, and weight control. Whether for fitness reasons or religious, fasting has a special impact on our metabolism, which is particularly important information for people living with type 1. Friends, most scientific research related to metabolic fluctuations during fasting is available in the context of fasting observed during the month of Ramadan. The information provided here is based on international guidelines published in the worldwide research, and its purpose is only to make you aware of the facts, with the knowledge of which you can keep fasts without worrying about the issues related with type 1 management. Before proceeding further, let's understand some basic facts about the fasts observed during Ramadan, which will make it easier for you to comprehend the detailed information. During fasts, nothing is eaten or drunk from sunrise to sunset. Before sunrise, people usually eat something as sehri and then go back to sleep. After the day ends, only after sunset, food is eaten as iftar. Sometimes something is eaten again before sleeping. Usually during Ramadan, certain special fruits, nuts, and dishes are consumed more frequently, and it is observed that these contain more sweetness and fat compared to regular diet. The special condition of diet results in distinct effects on metabolism. While there may be a risk of decreased blood sugar during fasting, increased blood sugar is often observed after sunset. However, with some dietary changes, regular monitoring of blood sugar, appropriate insulin dosage, and exercise, one can continue fasting for the entire month while avoiding these difficulties. Let's see, with this information, what we can learn from the Who Will Be a Type 1 Genius quiz game today.
Hello and warm welcome, ladies and gentlemen. Firstly, gratitude and thank you to all of you for watching this wonderful game of Who Will Be a Type 1 Genius. Friends, in today's episode, we are only going to talk about fasting with type 1, and today's contestant is 17-year-old Fatima, who has been living with type 1 for the past 7 years.
She is the topper of her school and wants to become a pediatrician one day. Fatima, how does it feel to be here?
Sir, I'm feeling quite excited. Actually, I have been fasting during the holy month of Ramadan for many years. And for this, I acquired a lot of scientific knowledge to keep type 1 issues under control while fasting. And today, we are going to talk about this only.
So, without making you wait any longer, let's ask the first question. Tell us, if a teenager living with type 1 diabetes wants to fast for the first time, which of these things should be checked first? In the HbA1c is controlled before Ramadan, be prepared for regular blood sugar checking during fasting. Be able to recognize the symptoms of hypoglycemia, or should all these things be good?
Sir, all these points are correct. If your type 1 is well controlled before Ramadan, only then will you be able to safely complete the fasts. People preparing for fasting for the first time should sometimes practice intermittent fasting in the days before Ramadan, so that the experience does not feel completely new to them.
Your answer is absolutely correct, Fatima. In the second question, tell us what dangers could occur if the boy from the first question proceeds to fast without proper knowledge of type 1 issues. The options are hypoglycemia, hyperglycemia, DKA? Or could all these dangers happen?
Sir, these can all be risks, and in addition, there can also be a risk of dehydration and blood clotting. If you want to observe fast while living with type 1, taking this responsibility on your part is necessary.
Correct answer. You have certainly done good research. In the next question, you have to tell which option among these is not correct about hypoglycemia during fasting. The risk of hypo is highest in the few hours before iftar.
One should avoid heavy exercise during fasting to prevent hypo. In case of hypo, it is necessary to eat something immediately. It is okay to skip insulin on fasting days to prevent hypo.
Oh, how will that work? Insulin cannot be stopped under any circumstances. Yes, during fasting days, some adjustments might be needed in its dosage. Besides, everything about hypo is correct.
Very good. You are absolutely correct. In the next question, you have to say which of these commonly eaten items during fasting has the highest amount of carbs. The options are 2 pieces of dried figs, 2 pieces of chocolate-coated dates, 1 piece of baklava pastry, or 1 piece of Turkish delight.
Sir, the answer should be 1 piece of baklava pastry, which has 25 grams of carbs. All the other options contain approximately 15 grams of carbs.
Your answer is also correct. Fatima, in the game's 5th question, tell us which option is incorrect for using a pen device for insulin? Based on blood sugar, the dose of long-acting insulin may need to be reduced by 20 to 40%.
Administering the short-acting insulin dose before Sehri and iftar based on the insulin-carb ratio and insulin sensitivity factor calculations like other days remains appropriate. Administering premixed insulin with a 70-30 ratio is suitable during fasting. Short-acting analog insulin reduces the risk of hypoglycemia compared to regular insulin.
Sir, the rest is fine, but using premixed insulin during fasting or anywhere else in type 1 diabetes is not correct, right? This option is wrong.
You also answered this correctly. In the next question, choose the incorrect option about the use of insulin pump during fasting.
During fasting, it is appropriate to reduce the basal rate by 15%. In the 3 hours before iftar, the basal rate may need to be reduced by up to 40%. Is it appropriate to give an extended bolus for 4 to 6 hours with the feast meal? Or should all boluses be taken at half the amount during fasting?
Sir, the bolus given before Sehri and iftar should be administered according to blood sugar and the carb content of the food, just like on other days. This is the incorrect option. Everything else seems fine.
Your answer and explanation are both correct, Fatima. The next question is about diet during fasting. You have to choose the correct answer. The options are: it's okay to consume low GI carbs at Sehri, which reduces the risk of hypoglycemia for a longer period. The main cause of increased blood sugar is frequently snacking after iftar. It is advisable to have Sehri as late as possible. Or all these options correct?
Sir, all these options seem fine.
Your answer is correct. In the 8th question, you need to choose the right option about blood sugar checking during fast, specifically when it is unnecessary to check your blood sugar. The options are before Sehri, after waking up post-Sehri, 2 hours before iftar, or right after iftar.
Sir, it is important to regularly monitor blood sugar during fasting. In the other option, checking is necessary. But instead of doing it right after iftar, if done 2 hours later, the effect of food on blood sugar will be shown better.
Wow, Fatima, your knowledge is amazing. Now you have reached the 9th question, where you have to talk about some numbers related to fasting with type 1 to identify which option is incorrect. The options are that the risk of hypo during fasting is up to 7.5 times higher than on regular days. 2% of people might need to be hospitalized due to hypo. If the A1C level is more than 8.5 in the days before Ramadan, the risk of hypoglycemia is higher during the fast in Ramadan. Or are all these 3 options wrong?
Sir, all these figures seem correct. It seems like this is the incorrect option, that all 3 options are wrong.
Correct answer. Fatima, this was a trick question, but you answered correctly. Let's see if we will find the next type 1 genius today. In the 10th question, you have to choose the wrong option again. The options are: during fasting, glargine insulin is better than deglutic insulin as a long-acting option. During the day, if you play sports like cricket or football, you should reduce the morning basal insulin dose somewhat. The use of a sensor-augmented or closed-loop pump shows a reduced risk of hypo during fasting. Or are all these options correct?
Sir, the first option is not correct. Insulin degludec is considered better because it does not have a peak effect.
Are you sure? Should I lock it?
Fatima, your answer is correct. You have become a type 1 genius. Congratulations to you.
Fatima's knowledge about Ramadan fasting was truly commendable. We hope that you can use the information provided here to safely and easily complete intermittent fasting, done for any reason while living with type 1. You may have heard some facts for the first time in this presentation, so you might not have understood them. There is no need to worry. You can revise your concepts related to main issues concerning type 1, such as diet, hypo, DKA, exercise, and feasting by watching other presentations of our Type 1 Genius Academy series. All these videos are based on international scientific guidelines. We will meet again with our next presentation. Until then, goodbye. Namaste. Bye-bye.